Welcome everybody to A Righteous Day. I'm your host Muhammad Islam, and today we have a special guest. First of all, we'd like to thank you all for joining us today to watch this informative video. This is something that's been in the works for a long time, and this individual we are interviewing today is very special to me and my family. We've been close friends for over 8 years now. About 8 years, right?
Yeah.
It's been a beautiful relationship. I've learned a lot from these people, and inshallah they've learned a lot from me. We've been helping each other since day one. My sister, very hard worker. She has a lot of knowledge. She possesses a lot of skills, and today she has a lot of information to share with you guys to help you out. And we'll go straight into the interview. Thank you. Introduce yourself to everyone.
Hello, everybody. My name is Nakia Tinsley, and like my bro said, I've been on him for 8 years, 7, 8 years, and it's very close and very dear to our heart. Has been, a big help and support system to all of us. I
Likewise.
appreciate it. Thank you.
Thank you. So we'll go straight into the questions.
Yes.
So obviously we're here because you're diagnosed with cancer.
Correct.
And my first question was to you is, when were you first diagnosed with cancer?
I was first diagnosed the end of 2016. Actually, I was going to for pain management for my back, and my pain doctor at that time was like, "We've done everything. Like, you've been going to pain management since 2006. It's time for you to have surgery." So I knew eventually like I would need back surgery, but I've been putting it off, to raise my kids and everything. So he was like, "I'm gonna start the process for the surgery. Go get your CAT scan and all that done." So I went for the CAT scan, and I was on my way home. And before I can even get home, the doctor called me and told me, excuse me, that I needed to go see a gynecologist right away because I have a huge mass in my abdomen, uterus area.
Wow.
Yes.
And I bet that was beyond shocking. There's no words.
Shocking was an understatement. But then it made sense because for months I've been asking him like, why every time around my cycle was my pain increased. And he told me, "Well, you need to go see a gynecologist." But something kept tugging with me, like it's just a coincidence. Like, until after I found out like the mass was there, that it made sense.
Yes, where the pain was coming from.
Right.
Now, this cancer you're referring to, does this have a specific name, or?
Yes. The broad is a sarcoma. The type of cancer I have is Leiomyosarcoma. It's a very, rare, aggressive cancer that a lot of chemos, don't work for.
Okay.
So with my first occurrence, I was able just to get surgery. They took out the tumor.
Wow.
And the tumor was like 13.
I remember that. That was crazy.
It was like basically like this big.
So after you were diagnosed with this cancer and you seen what it was the first move you guys had to make?
Well, actually, like, they didn't know what it was. I made an appointment with found a GI doctor just looking through,
Internet.
the internet, Google, and found one that, come to find out, was the chief surgeon of our local hospital.
Which is what? Reading.
Reading
Hospital.
Tower Health now. And they took me in right away. They ran tests. I had to get more scans. And he was assured that he would remove the tumor. They gave me the protocols, what's the worst that can happen, and whatever. Went in for surgery. So I'm thinking, like, prepare myself for the worst. The worst was I'll have a hysterectomy. Come out of surgery, and they said that the tumor was so large, and it wasn't where they thought it was, that they had to stop the surgery, bring in a general surgeon, which also happened to be the chief surgeon at the hospital. And he took a look at me and said that he couldn't do nothing at that time because he just opened me up and just saw this huge tumor, right? So I had to prepare for a second surgery. So my first surgery was in November of 2016. My second surgery was in February of 2017.
Okay, just to backtrack a little bit on what you said the first time you went in, they diagnosed you and found two tumors.
Correct.
And when you went back to the emergency room the last time, this time it was different. You said they found a large amount.
20, at least 25.
Wow. And that was within how long time frame? From the first...
It was like a couple of weeks, like almost a month.
Oh, wow.
Yeah.
1 month and it spread that much?
I just started having this terrible pain in my stomach that would not go away. And usually, like, when I take, my pain medicine, I get some type of relief.
Mm-hmm.
And nothing was helping, nothing. So, I'm like, something's got to be wrong. Like, I'm not getting no type of relief from my pain medicine at all. Like, so that's why I went in.
Wow.
And that's how quickly, like, this cancer can develop and spread. That, that quick.
Wow, that's amazing. Because, in 1 month we do so much. You would never think that inside of your body there's a whole nother world that's evolving. That's crazy.
Exactly.
That's scary too.
And the scary part about it is that this type of cancer, like, for one, like, there's really no true cure. They have, chemo and treatments that, may or may not work for certain people, but there's not like a definite set cure. The best option, and longevity with this, cancer is surgery, basically.
Okay.
But it's like very aggressive, and it can spread, and grow very rapidly, like,
Yeah.
And the sad thing about it is, when my first occurrence, since I was misdiagnosed the first time, and with the second time, when they took the tumor out, they didn't explain to me how serious this cancer was. They just told me, like, come back every 3 months, because that's like the protocol after you get a tumor removed and you have clear margins and you don't have, that's the protocol, is go every 3 months.
Mm-hmm.
So that's why I stopped, like, the second year. I went a whole year, I'm fine. And I'm like, okay. So it wasn't explained to me how serious it was until I researched and found, a group on Facebook that I was like, wow, like, this is serious.
Yeah.
This is serious.
Now, the people on Facebook that you found, your new friends now,
Mm-hmm.
similar type of cancer, or?
Yeah, they're mostly have the same, the same type of cancer, but it develops
Different.
in different places of the body. Sarcoma is a soft tissue. That's where it grows in like soft tissue.
Okay.
Throughout the body. Like it can happen, like I said, in the lungs.
Mm-hmm.
Some people had it in their shoulders, their legs. A lot of females have it, in their reproductive, organs.
Okay.
So like this, like anywhere in the body.
Wow.
So February, I prepared myself for the second surgery, and again, you always told, what can happen. Prepare myself for that.
What did they tell you exactly?
Oh, that you may, they may hit an artery or something. You lose so much blood, you may have to get a blood transfer, a hysterectomy, and I may have to get a colostomy bag.
Wow.
So that was the worst. So I tried to prepare myself, go in for the surgery. I come out and everything went well. They said that they removed the tumor intact. I had clear margins, and that I would have to meet with the radiology and chemo department to see if they want to further along and, to get chemo radiation. I met with them, and they said since everything was good, like I had clear margins and everything, I wouldn't have to get chemo or radiation at this time. One thing about this was the first time that they took a biopsy, the tumor came back non-cancerous. After I had the surgery and they took it out and they sent it to the pathology, actually they sent it to 2 different offices to check it out. That's when it came back cancer.
Oh wow.
So
So they were confused at first.
it wasn't confused. I guess the tumor, like it was 2 different different types of cells.
Oh, okay.
So the portion that they took was non-cancerous. But when we went through and dissected the whole thing, that's when it came out that it was cancer.
Wow. So I could only imagine something like this. It's definitely life-changing. But I'm pretty sure, I'm almost positive that you had other things in life that was going wrong, or could have been going well. Was there anything else in your life that was a major obstacle at that moment?
A week or so before I had the surgery, the end of January, I had the surgery like February 8th. It was on a Wednesday. So a week before the surgery, that like the end of January, I get a call that my mom is being transported to the hospital. She's having trouble breathing.
Wow.
So I raced up to New Jersey, and she is being incubated. It's just walking in and seeing your mom hooked up to different tubes. So the doctors are telling me that she has the flu, and I'm like, no, like she's it's something with her heart. Like she has CHF and stuff. And they was trying to treat her for the flu. So a couple days later, they was like, oh yeah, it's her heart. I'm like, I've been telling you for 3 days. So I told her, I told my mom before I was to leave to go prepare for my surgery, like I'll just postpone it. And she was like, no, you've been suffering long enough. I want you to get the surgery. So I made sure, she was okay. She had to go to rehab. I made sure she went to a rehab that, I work in the nursing field, that it was a rehab that, I worked with, and that, would take good care of her. So I left on a Tuesday. My surgery was on a Wednesday. I'm talking to her this whole time. I go in for surgery. I come out. Like I said, everything, is good. I told her, I'll be down as soon as I get out the hospital. Make sure you're okay, bring you more clothes, whatever. So I come home on a Friday afternoon, came home. I talked to her a couple times. And the last time I talked to her, I said, I'll be up tomorrow morning, Saturday, to come see you. Get you more clothes, make sure everything is going well. But this whole time, I'm sensing like something is wrong. Like she doesn't sound herself. Like her voice wasn't the same. Everything, like something was wrong. But she told me, leave it alone. She's okay. So I said, okay. Go to sleep. This is around like 8, 9 o'clock. Around midnight, I get a call. And it's the rehab calling me, saying they're rushing my mom back to the hospital. And that it didn't look too good. They say that she's having trouble breathing again. So I jumped up, put clothes on, sped all the way there to the hospital.
From PA to New Jersey.
Correct. And I'm calling the hospital, trying to get an update. They was like, we're working on her, we're trying to do everything we can. So then this kindness came over to me. Like I said, working in the nursing field, I already know. And I'm just like, I know this is not going to be good. We get to the hospital, and anytime they take you to this family room, like it's not good. So the doctor comes in, and he's like, Miss Tinsley, we did everything we could. I'm like, just tell me. And he keeps trying to explain. I'm like, listen, just tell me. And they say she didn't make it. So trying to heal and dealing with what's going on within me, and then
That just made it harder. Impossible.
So, and it was when I left that day to come back home, and I left her. I was walking through the garage to go to the car, and before I got to my car, I looked down, and I noticed like something shining, glittery. So I picked it up, and it was a necklace with a charm on it that said Mom. So I was like, wow.
Yeah.
And I still have it till this day.
Wow.
Like I something was like, this told me to keep it. Like.
That was your mom's necklace.
No.
It just said Mom on it.
It just said Mom on it. It was
wow.
just on the ground.
Yeah.
A gold necklace. It was a gold chain and a gold charm that said Mom on it.
Wow. And this was all around the same time, as far as your mom passing away and
my second surgery.
Now, obviously, you answered some questions I have already. Now, I know definitely it affected your daily life. But what is the most crucial thing you would say that it really affects you every day? What's the number one thing that bothers you the most because of this, the being diagnosed with cancer?
Um,
Unless you want me to clarify a little bit more.
well, I was diagnosed again um, in 2019. The end of 2018, in the beginning of 2019, I started having the same pain that I was having with my first occurrence.
Okay.
And I put it off because I was working. It was my younger son's last year of school. And I just wanted to work as much as I could to get him through his senior year. And something was like, you need to go back to your doctors. Now, after I had the first occurrence, they was like, every 3 months you need to get rescanned or get another MRI or CAT scan every 3 months.
And I remember that. That was
Exactly.
crucial. That was hard.
For the first 2 years. Yeah. And so the first year I did. Then, with the situation after my mom, I just stopped. So I
Stop.
going to get my
or the treatment.
No, they will get my scans.
Okay.
I just went about a year without, going to get. Yeah, I was feeling fine. I was actually feeling normal. I was able to work.
I remember you used to tell me, bro, I don't feel no more pain.
Exactly. I'm doing good. Like, I was feeling good. So then I started having, this tightness in my legs again, and the back pain. So I called both of my doctors, the general surgeon and the GYN. I need to make an appointment. So I go to the general surgeon first, and he was like, so, like, why are you back? I haven't seen you in a while. And I was like, I'm, having pain again, and, I just think I just need to get checked. It's been a while. Told him everything that was going on. He said, okay, sign me up for blood work and a CAT scan. Saw my GYN, same thing. And I get a call and went in and they said, the cancer's back. So this was in like April of 2019. So I said, okay. So they set me up with the cancer center in my local hospital. And before I went to that appointment, was able to get that appointment, I was in so much pain, like nonstop. So I go to the hospital. And they run a blood work and CAT scan. I'm getting program prodded. So, how you have the My Chart, like you can go see the results. Exactly.
Yeah.
So
I actually looked at your chart before in the hospital.
Exactly. So, it pops up, like your results are back. And I saw my results before the doctor even came in. And
that just made you...
I just started crying. So the doctor comes in and he said the cancer has metastasized throughout your body. It's in your abdomen. You have two tumors in your abdomen that are a nice, reasonable size. Your liver, my colon area, rectum area, and my lungs. And he says about a total of like 25 that they can count. And for them to count, it has to be like, a reasonable size.
Yeah.
And
meaning they're counting the blood cells?
no, they're actually counting the tumors. So from what the CAT scan or MRI, I forgot which one I got first, picks up, they counted at least 25.
And how big were one? Like
The smallest one was like a tenth of a centimeter or something like that.
I get it.
Whatever,
Okay.
like to, I think it was 7 at that time. The biggest one was like 7 centimeters.
Wow. That's about what, approximately 4 inches or something. That's a lot.
I don't know, I'm not.
Something like that, 4 or 5 inches.
So,
Wow.
I get admitted, and like the next day, I have all these doctors coming in. The radiologist, the chemo doctor. So I have this one doctor come in, I think he was radiology, and he was talking to me. I was by myself, my family had just left to go home, to pack me a bag and stuff. And he sat down and talked and introduced himself, and he was like, just so cold and so, was telling me like, it's not, a good outcome, because the cancer has spread all throughout your body. So I was like, okay, so is there do I have like a time limit? And I had said this before on, on Facebook. I did a video, and he said 6 months to a year, approximately 2.
Yeah.
And I was like, well, I know I asked the question, but how would, like, you're telling me this and I'm by myself.
Yeah, that's
my family just left. Like, I can't comprehend everything that you're saying. So, I just,
Now, obviously, he told you 6 months to a year, almost 2 years. It's been, since then? A year?
It's been all over a year.
Because I remember you were telling me about a year ago, I have 6 months to a year.
Right.
And your husband was telling me, the doctor was really cold when he was in there talking to her by herself. I can't believe he said that. So knowing all this, what the doctor told you and what you were already aware of, would you go back to, are you still dealing with this same doctor or no?
I still see the same gynecologist. I was set up with a team at the local, like I said, the cancer center. I have palliative care, my pain management team that helps me with my pain. I have an oncologist, and I have my radiologist. And then they referred me to Fox Chase Cancer Center in Philadelphia.
Okay. Which is ranked number 2, I believe, or number 1.
They're one of the best.
Yeah.
When I was referred to go for a second opinion, it was either Fox Chase in Philadelphia, or I think it's M.D. Anderson in New York.
Okay, yeah.
But they didn't take my insurance, so I went with Fox Chase.
Okay. Obviously, I see you have the PCA with you.
My friend.
Yeah. Now, does that mean you're always in pain still? Are you still, are you feeling pain right now?
Yes, I'm in pain 24/7. It's handled much better now. I went from different kind of pills, different strengths, to having this. It's just pain medicine that I get delivered to me. I have a port right here. It's hooked up right into my artery. It starts from my neck down to my chest. And I get medicine 24 hours a day. And I can press it if I'm like in extreme pain. I can press a button and I get like a bolus dose. I can do that 4 times an hour. And actually, I've been starting now getting it lowered. Trying to lower, because we're trying to get off of it since I've been doing better. So usually my pain ranges from 3 to about a 7 or 8 at the
Okay.
highest.
That's still, to feel it every day, that's a lot.
Yeah.
Now that you're saying you're trying to slowly wing off of that, is it because it's addictive? Is it controlled substance?
It is a controlled substance. It's funny that you asked that because over the summer I wanted to go to the beach. So I asked, my pain management, I wanted to be disconnected because I wanted to go in the water. I wanted to enjoy, life as a normal person without being hooked up.
Yeah.
I have to cover it even to get in the shower. Like,
Of course.
the dressing can't get wet. So I just wanted, a day off.
Yeah.
So I was able to get disconnected, and then they gave me like a couple pills like to get me through just in case if I needed it. So I go to the beach. I'm feeling fine at first, and then I just started feeling weird, like nauseous to my stomach. And I slept the whole time I was at the beach, the whole time. And I've never been like that. I'm loving, like sometimes I'm always out, amusement parks, whatever, with my family. And my grandson's first time at the beach, like, I felt terrible. I come home, and then I just started vomiting. And then I was supposed to get hooked up the next day on a Sunday, and I couldn't even get up for them to even come back to hook me up because I have a nurse that comes every week to, change my dressing and change my medicine bag. And then I was just like sick. And then I'm like, wait a minute, I think I might be going through withdrawal. So Monday morning I called my, palliative care team, and I talked to them, and I asked them, I'm like, am I addicted to this? Like, y'all know, like, I hate taking medicine. They was like, no. It's like your body is, but you're not physically addicted to it. And that's why I always, it's weird that you said, I know that, like, opioids is, I hate to get off topic, but, like, opioid, is a crisis right now.
Yeah, oh yeah.
But what people fail to realize, that when you're in truly pain,
sometimes the only thing that helps.
that it helps because you're in pain, because you truly have pain. So that's why I always like limit myself or took the lowest dosage, because like I never knew like how strong my pain would get.
Yeah.
So like you have cancer. Like cancer is one of the worst pains. Like
I've heard.
So if I have so much pain, I'm at a high dose. It's not enough for me to take.
Mm-hmm.
So I called them and I'm like hysterical because I'm like, y'all know I don't like this. Like I don't like feeling this way. So I got hooked back up, and then they apologized because they didn't explain to me everything that was that would have happened. Excuse me. They didn't explain to me everything that could have happened. So
you had to find out the hard way, pretty much.
It was yes.
And yeah.
Yes.
After going through all this, I'm sure they had some sort of treatment plan set up for you or a guideline. Mm-hmm. How did that go? Can you explain that a little bit?
It took about a couple of weeks, maybe. Like I said, I got referred to the cancer center, met with my oncologist, and she recommended a treatment plan. Like I said, they referred me to Fox Chase. So she wanted, I had to see what they wanted to do. Mm-hmm. So I go to Fox Chase and met with, an oncologist there. And from my research of her and, the reviews, she, was a top-notch doctor. Like, she knows her stuff. Like, she is a specialist in Leiomyosarcoma. So, she gave the same exact recommendation that my local oncologist gave was to do, it's like a border, like the recommended treatment plan to start off, with.
Like a guideline?
Yes.
Okay.
We call it gym tax for short. I'm not going to say the long names. So.
Gym tax. Wow.
Exactly. So I go back, come back home, and so I get a call from Fox Chase saying that they have a clinical trial for me, that I was a good fit for. It was, I forget how many weeks of radiation, and I would have to take a pill. So I have to go for 2 weeks, 5 days a week, to Fox Chase to get this pill. I'll get blood work, and then I'll take, a dose of radiation. So I did that for 2 weeks. And there has to be, a separate, time from when you get radiation and chemo. So I finished, I think around September with, the clinical trial. And I started chemo around November.
Of 2019.
Of 2019, correct. I started having problems, a lot of pain, in my rectal area, in my stomach area. I was in and out the hospital. They couldn't find anything wrong. And it wasn't until November that they came. I had side effects from the radiation to my colon, so they put me on medication, and it started to get better. So I started chemo, and it took about a couple weeks. I started losing my hair. I remember last Thanksgiving, I was bald.
Yeah.
And Christmas,
You look good bald though.
Thank you. I always loved short hair.
Yeah.
So that actually really didn't bother me, losing my hair. Because I always loved short hair.
Yeah.
So, but every time I would do, so 1 week I would do just one of the chemo. And the second week I'll get both of them. And then the next day after I received both of the chemos, I would have to go in and just get a shot in my arm. That's to help bring up, I think it's my white blood cells.
Okay.
But it also causes, everything has a side effect. It also causes bone pain.
Oh, wow.
Now, bone pain is the worst pain ever. Yes, bone pain is the worst pain ever. It just...
I can imagine.
It's like... It's it's so hard to explain. It's like nothing can touch it. Like, if pain was on the outside, like on your skin or whatever, like it's just topical, but it's like deep, like inside of your body. So
it's not something you could just reach in, rub it.
Yeah, you can rub it, exactly, put a heating pad on it or whatever. So and they say take Claritin, because Claritin, supposed to help with the bone.
Allergy pills?
Yes.
Wow.
And no, for some people it did. What? No.
Made you sleepy.
Not even that. It just. That's the only thing I could do was sleep. Take something to help me go to sleep. So, and then I would end up in the hospital because I would end up, vomiting, and my blood levels would drop. So this happened every time I got both doses of the chemo. So around March, I was like, I can't do this anymore. I had lost so much weight. My face was sunken. Yeah. Truthfully, when I first started, I was 300 pounds when I first started. And my lowest weight that I got to was 184.
Wow.
So I'm around like 194,
Yeah, bro.
right now.
You're killing that 194.
Thanks. Thank you, bro.
Definitely. No, I remember I've seen the transition. I remember it was scary at one point. Even Nashir, like he used to tell me, she lost weight quick, man, because of the.
I want to thank you
You're welcome.
for being there for him.
Definitely. That's my brother. Always.
It hurts me to see my significant other. Like, he wouldn't show it, but to know that, like, he's hurt because
He loves you.
he can't do nothing to help me. And, I would just say, just you being there, you just rubbing me. Like, just your presence is enough. Like, I know you can't do nothing to help that, help me. But just you being there. But you being there for him. And him having a confidant to talk to. Like,
We all need that support.
exactly.
Mental support is very crucial in our living,
And I remember, like, when it's funny because when I lost my hair, or somebody see me, they haven't saw me in a while, and they saw like how much weight I lost. They try not to show, but your face shows everything. And you can see people's eyes just go like, wow. And then you lost so much weight. So getting back to my treatment plan. So I stopped, the chemo. I told my doctor, like, I can't. So all in all, I had about 5 to 6 treatments, mind you. I was supposed to have around like 14 to 20 treatments. So I was in a hospital. My birthday's March 14th, and I was in the hospital. This is when COVID like really started, coming about.
I remember the hospitals were jammed and
exactly.
You couldn't do nothing.
So they told me, like, you need to go home. Even at that time, I was so sick, and I had got a CAT scan and had to get the IV dye. I was so unhealthy that I went into acute liver failure.
Wow.
I'm sorry, acute kidney failure. My legs were like 3 times the size. I couldn't wear no shoes. I had to go out and buy like men's size 13 slides.
Wow.
And barely could even fit that. And the pain, caused from that. And there was really nothing they could do about it. So they was like, you really shouldn't be here because we don't want you to get sicker. So they sent me home and said your body will heal over time. And it took about a good month or so for, my legs to go back to normal. But I'm left with neuropathy now in my feet. And
that's another problem.
Another problem. It's always a side effect, of a problem,
Yeah.
And so a couple months later, I went to go see my local oncologist. And she said that, I think this was around like April of this year, May of this year. It's time for you to go to Fox Chase and see the oncology surgeon. You need to get these tumors out. So I went to Fox Chase and had to go, see my whole team over there again, do blood work and get all my scans. So I make an appointment with the oncologist surgeon, before I'm walking in, I told my babe, like, I started crying, like, I don't want to go. I don't want to do this. You know, I'm just crying. He's like, come on, babe, like, you got to do this. So I go in. Like I said, I always prepare for the worst. And he's talking, giving me a whole bunch of, analogies and all that. And he said that to open me up again, to get, at this time, I only have 2 tumors.
Okay.
Okay? Where all the other ones went, like, I don't know. I know. God is good.
God's good.
He's, very confident he can remove the tumors. He said that my last MRI that I did, that the tumor that they saw in my rectal area is not there anymore. That they only see, swelling. And the tumor that's in, I have one on my left side, abdominal wall. It's been stable for over a year.
Wow.
Now, mind you, I told you in the beginning, last year, I go for a month, from 2 tumors to 25, to them only seeing 1.
Yeah.
Now.
That's amazing.
Okay. He said, so right now surgery would be pointless. Why open you up? Because you're only limited so many times that you can have surgery. Like, your body can only go through, like, this major surgery.
Yeah.
And he said, like, this time, it will be definite that you will have to get a colostomy. So that's why I'm going in, and I was crying, like, going in, like, I know that this surgery, I'm going to have to, walk out with a colostomy bag, preparing myself.
Yeah.
I'm 43 years old, like, working in nursing homes, hospitals, like, I've dealt with them before. It's something that, you don't want to go through. A young person, anybody, will want to go through. It's a body image thing, a self-image thing. So when he said that the cancer is not lighting up, like, when you get the dye lights up on the skin, and there's nothing lighting up. So he said, go home, enjoy your holidays.
Wow, I bet you were the happiest woman alive.
And I'll see you in February.
Wow.
And I was just sitting there, and I just started, I was, nervous, I was anxious, I was, had all, I just started to become calm. And in the back of my head, I just kept hearing, when I was in the hospital, I told you, in May, when I went back to the ER, 3 of my cousins come up and visit me. My baby cousin, the youngest one, she's first lady, of the church, and, her husband is a pastor, which is also my cousin. I grew up with him. I've been knowing him and his family, which is actually, my babe's family, all my life.
Mm-hmm.
She comes up and she takes a bottle of, oil, anointed oil, and starts praying all over my body. And she kept saying, you shall live and not die.
Wow.
And I was like, I felt grateful that she traveled, all the way up here to see me. They all took their time out to come up and see me. And, she prayed over me. And her slogan was miracles, signs, and wonders.
Okay.
And she was like, kid, you want to have a testimony, after this. And she would keep in touch with me, you know, after I came home and throughout my journey, you know, she'll always call in and check on me. And it's hard because I was preparing myself, you know, to not, you know, be here. You know, you're given a life expectancy of maybe 6 months to 2 years or whatever. You know, this in the back of your head, like, this is uncurable cancer. You know, it's rare and it's aggressive. So, she passed away last year, and it's like, I'm the one that's supposed to be going in, and she's not here. And you prayed life over me, you know, and I can't share. And you're not here to see.
You living.
Exactly. And it hurts, and it's just, you know, heaviness. But, you know, I'm just thankful that, you know, she took the time out to come and, you know, see about me and pray over me, and, you know, to give me life, you know, and to speak, you know, life into me. It has been a journey. It has been like days I didn't think I was gonna make it. The days like I couldn't get out of bed.
It's okay.
I couldn't eat. Didn't have an appetite. But I'm still trying to be strong for my family. You know, you see your kids. Having your kids see you go through this. And I just kept, you know, I gotta fight. I have 2 beautiful grandchildren that are my world. And I'm just thankful to be here alive.
Definitely.
To be, even though I'm not still 100%, you know, I still have pain. I still, you know, but to be able to spend another holiday, you know, with my family. Like I said, last year, this time I was walking around in pain. I was walking around and, you know, bald-headed. Here I got a little bit of hair. You know, I'm
looking healthy too.
Able to get up and move around, like, you know, when I can. If you don't believe in God, like, and my faith did waver. After my mom passed, it did. I lost that connection. And I said to myself, like, I really didn't tell nobody this. But I said, God, if you get me through this.
Okay? Yes, take your time.
If you get me through this, I know that you are real. Because one, like, I said, like, in the doctor, I said to them, like, well, where did all the tumors go? Like, you go from 25 to having, like, 1. And, I met a friend that I'm really close to off the Facebook group. And She has the same type of disease as I do, and she's a lovely woman. I love her to death. Like, we became so close, and we shared our stories. As a matter of fact, I met her for lunch after I found out, the good news, and I didn't even want to how can you share your story when somebody else is suffering?
Yeah.
Too, or they don't have the option to have surgery. Like I said, I only did 6 rounds of chemo, if that many, and then the clinical trial, the radiation, and then the pill.
But some would say that's a blessing.
It has to be a blessing. Like, I've been asked by doctors, you're a miracle, or are you a miracle? Like, it's you. My doctor said, we don't see this.
Especially after they just told you you're gonna die 6 months to a year. That's mind blowing,
Exactly. It really is. I was really, preparing myself, my partner, this, it may be a reality. You hear all the negative words, and I'm a person, I live in reality, but then, it's I look back, even my doctors are so great. I mean, I especially my local doctors, they call me personally, if I have a problem or I'm suffering or whatever, I'll call the office. Usually the nurse will call you back. No, they call me personally. And that is something special. I haven't seen my gynecologist in over a year, and I just saw him a couple months ago, and he was like, I didn't expect to even see you. And he was like, you look great. He was like 2 times, he was like, I just read your MRI report, but it said nothing is detected.
I bet he was shocked. What's going on? He himself didn't even know what was going on. I remember you were telling me that this type of cancer is a non-textbook cancer. So it being a non-textbook cancer, I'm sure in the back of their mind they're always thinking about ways to help you or ways to come up with a new solution. For him to just see you magically or miraculously with 1 tumor left, it must have just blew his mind,
It did. He was, when you're going through something, you don't see the finish line, but when you get through the finish line, and you made it through, it was everything was worth it that you went through. No matter what trials or tribulations you go through, you didn't have a clear path, it seems so difficult or so tough. But once you get through it, it was okay.
Big burden off your shoulders.
Exactly. Okay, let's tackle whatever comes next. I made it through that. That hell.
If you can make it through that, you can make it through anything.
Basically.
That's the mentality. Yeah.
Basically.
I mean, I could only imagine being in a situation like that. For me to overcome death or obstacle facing death, that would change my whole life. That would change everything about me.
It did. I more positive. I try to make every day as positive as possible. Not to dwell on the small things. Don't take life for granted. and make sure I tell everyone that I'm close to, I love you, because you never know. Anything can happen. But this has been, a journey that, has opened my eyes and made me realize that life is short, I lost my mom, I've lost a cousin, several years ago. Her sister passed away, my other cousin,
Well, that adds up.
both, one cousin was 30, 34, 36.
Wow.
My cousin that just passed away last year. She was just about to be 40, I think, or 41.
Wow.
And, it seemed like our generation is like, when I had a cousin, another one that passed away, too. It's like, so that's why I live each day, like, the best as I can, if only I can just walk downstairs, I try, to do and live each day the best that I can and try not to, hold any grudges. And I'm very happy for my support system, all my friends and family, people, I do live far away, like, an hour away from, my family in Jersey. But to the people that did call, then, send me text messages, care packages. I just want to thank everybody, who was there for me or still there for me, called to check up on me. To my sons being there. My future daughter-in-law, I love you. Like, and to my baby. He's been the best. Like, there's times like I couldn't even understand or know what's going on with my doctors. And I would like, what did they say? I had to go back to him like, I don't know what's going on. Like, what did they say? Or, what do I have to do? Like, he was right there and right up on it. Like,
I remember. And he still is.
Oh, yeah. Like, he's been, my rock, my shoulder to cry on, my friends from work. To everybody, I just appreciate you need that going through this. You need a good support system.
Yeah, it makes things not easier, but it makes you more comforted while dealing with it. Nothing's gonna make it easier physically,
right?
But emotionally, it can.
It makes you feel. It makes you feel love. It makes you feel.
Makes you want to live.
Right.
Like when you have your.
It makes you like when you're going through the worst in your life that you have somebody there. You have somebody there. Just the kind words. The strength, the prayers. It's just.
It's a blessing.
And I just want to, tell, like, this cancer can happen in men and women, but for us females, go get checked. A lot of this cancer develops in the reproductive system, your uterus, fibroids, if you have them, get them checked, make sure they're tested, because a lot of them came back. That's in my Facebook group. They, got their fibroids taken out, and they came back with this cancer. So it can happen in men and women, but I see like it's mostly women, but it can happen in men. And that if you just don't feel right, like get checked out.
Yeah.
Like I said, I know I was having pain, but then it was different. Like I told you, I asked my doctor, like, why around my cycle, like my pain is different. So I know I had a scan a year before, and then I went to the doctors, and nothing was found. So I don't know how long I had, my first occurrence, how long I had this tumor, but I know I had this pain that was different. So I'm just saying, just get checked out, and if you know that they don't find anything, just keep, you don't have to be a nuisance or whatever, but if you having a pain that is not being relieved, or, keep pressing. That's one thank you again for taking your time out.
You're welcome.
Getting my testimony out there, and thank you for being a true. You're not a friend, like you are a brother. Like you've been there for us.
And likewise, honestly.
True, but
we both help each other out, us three, and including your family.
Like that's when you know who your true friends are. When you're down and out, you know who your true friends are.
Yeah.
So thank you, and happy holidays. Keep praying for me, and I love everybody. Thank you.